also today our action partners, I want to welcome you to today's program, Breaking the Myths of Aging, a conversation with local aging experts. We are so pleased that you've chosen to join us today. The mission of Westminster Events is to provide a forum for the sharing of diverse and informed points of view on important issues that impact Marin County. And we do this by hosting speaker programs at different points through the year. All are welcome to attend these free events where our goal is for you, the audience, to learn, connect, and grow as a result of what you hear. Before I give you an idea of what you can expect today, I want to invite Rob McClellan, Senior Pastor here at Westminster Presbyterian, to say a few words.
Thank you, Mary Beth, and thank you to the entire Westminster Events team. As Mary Beth said, my name is Rob McClellan, and I am delighted to welcome you into this space, into this home of a very special group of caring people, an open congregation filled with diversity and love for this community that we share together. Here at Westminster, we believe we exist not only for ourselves, but for the wider community. And Westminster Events is one important way we endeavor to give a gift freely to the community with no expectation of return. So thank you for coming together, for gracing us with your presence, and for being partners in building a more caring community for all. I hope you enjoy the program.
Thank you, Rob. A bit of housekeeping before we meet our speakers and begin the discussion. When you arrived, one of the items you were given is a sheet on which you're welcome to write a question for the Q&A portion of the program. There are pencils in the pews, and later in the program, when you see our volunteers come down the middle aisle, that's when you can pass over those sheets, and we'll make sure that they make them up to the moderator. The speakers will answer as many questions as possible during the time allowed. Another item you were given is a brief program evaluation, which we really hope that you'll take a minute to complete, because your doing so will provide us with valuable feedback that will help us better plan for future programs. In addition to those two things, we're going to keep you busy today, we ask that you add your name and email address to a page on one of the clipboards being passed around. This is optional, of course, but that way you can help us build our database and we can keep you informed of upcoming events. At the conclusion of today's program, you're invited to enjoy a reception and information fair in our Finley Hall. There you'll find refreshments and tables where representatives from organizations involved with work relating to aging have materials you can take with you, and they will be available to talk to you about what they do. Our speakers have also graciously agreed to stay for the reception, so if you have further questions for them, you're welcome to ask them there. And last, please take a few seconds to be sure that your cell phone is silenced. Thank you. So, now that we've covered all of that, let's move on to the topic of the afternoon, aging. It's a word we hear mentioned more and more these days, and for good reason. Our county's public health status update for April reported that the average life expectancy in Marin is high, 85.2 years. In comparison to the rest of California, which is 81 years, and to the rest of the United States, which is 76.2 years. Recently, I attended a workshop where the facilitator said something that has stayed with me, and that is, we're all experiencing aging for the first time. None of us has ever done this before. It's so simple, but so striking. No one has gone through it and then returned to teach the rest of us how to proceed. So, because aging is new territory for each of us, we want to learn all we can about it and discern truth from myth so we can know what to expect, how we can do it right, and how to make the most of it. Our guests today, though also first-time agers, can help us do just that, for they bring to the discussion years of experience and knowledge working in the field. They've seen and learned a lot, not only about what's available in terms of resources for our physical well-being as we age, but also, and just as importantly, about how we can approach our later years with positivity and peace of mind. It is my great pleasure to now introduce our moderator, who will then present our speakers. This amazing woman is a resident of the town of Ross, where she has lived with her husband Mal since 1991. She began a career devoted to helping others as a Peace Corps volunteer, training teachers in Ghana, West Africa. For much of her adult life, she worked for the San Francisco Department of Public Health, where she held several management and director positions, including directing community health education, HIV counseling and testing, and managing community planning for emergency preparedness and response. From 2011 to 2024, she represented Ross on the Marin County Commission on Aging, serving for 2 years as its chair. And in 2018, she initiated the Age-Friendly Ross Task Force. Please join me in welcoming Terry Dowling.
I'm going to sit down. It's a little more comfortable and a little more informal. Good afternoon, everyone. What a great turnout for this thought-provoking discussion. We're exceedingly lucky to have 2 excellent panel members with us today. Sonia Dolan, Sonia to my left, is a co-founder of Mental Health, a remarkable organization that offers personalized support for individuals and families facing serious illness, grief, and caregiver challenges. And Joe O'Hare, also to my left, who has provided executive leadership in healthcare and nonprofit organizations with a focus on aging in Marin County for over 40 years. Both Sonia and Joe bring passion and commitment to individual and community well-being. There is more information about each of the panel members on a flyer that was handed out or you will get in the other room. So this afternoon we're going to talk about breaking the myths of growing older. What are those myths about growing older? I bet you know a few of them. Older adults should not exercise too strenuously because they will injure themselves. It's normal for older adults to be lonely and depressed. Older adults can't learn new skills. Older adults don't have sex anymore, and on and on. Many people make assumptions about aging and what it's like to grow old and how old age will affect us. Beliefs and myths about this stage of life shape how we see our future. How do you see old age? Still with mountains to climb and worlds to conquer? Or do you see yourself on a front porch rocker with friends and family, treated with respect and love? Or perhaps alone in a residential care facility or an institution or a skilled nursing facility with little privacy and little dignity? Each of us has a good deal of control over how we age, while acknowledging that there are aspects of growing older that may be out of our control. As we get older, it's important to understand the positive aspects of aging as well as its challenges. Research has shown that most individuals can help preserve their health and mobility as they age by adapting or actually continuing healthy habits and lifestyle changes. Our 2 wonderful panel members will help us look at older adults in Marin today. Who are we, and what can we do to recognize our full potential? The panel members and I hope you will discover some new ideas and resources that will inspire you to try something new and to think differently about aging. I'm going to start by asking Joe a few questions, and then I'll ask Sonia a few questions, and each panel member will have about 3 minutes to answer these questions. But Sonia and Joe, if you want to chip in and add a comment to some question that the other is answering, please feel free to do that. And time permitting, at the end, I'll ask both of them some sort of open-ended questions. And lastly, as you heard, you will have an opportunity to ask our panel members questions. So think about questions you have, write them down, and as we go through the session, somebody is going to come and collect your questions, and then they'll come up here, the questions, and then we'll ask our panel. Okay. So, okay, Joe, let's start with you. All right, Joe, tell us who we are. Okay, who are the people over 60 that are living here in Marin? What do we look like? Who are we? What are the key trends for those of us who are older adults in Marin County? You've had a lot of experience with this, so.
Well, thank you, Terry, and thank you for the opportunity to meet with you today. I see a lot of friendly, familiar faces in the audience, so that's really good, and it's a subject, obviously, that is near and dear to you, and it's near and dear to us that work in the field. So I just wanted to start with some numbers, just so that we can frame who we are. Marin's population is 254,000 people. Of that 254,000, 27% are over the age of 60. That's 68,000 of us. I'm 74. I've lived in Marin for 35 years, so I'm in these statistics, as many of you might be. Now, by 2030, which used to sound like a long time away, in 5 years, it'll be 1 in 3 over the age of 60. That's 84,000 people in this community over the age of 60. Now, to give you a comparison to the other spectrum of life, children in Marin, under the age of 15, there are 47,000. So it's practically double the number of residents here of children to older adults. And I'll talk about a little bit why that's important. It was mentioned our life expectancy. Mary mentioned the life expectancy being 85.2. We are the oldest county in the Bay Area and one of the oldest counties in the state of California. One thing that's interesting, though, about the longevity or life expectancy, it varies tremendously where you live and who you are in Marin. As an example, the highest life expectancy is in Waldo Point, Sausalito, at age 92. Now, less than 3 miles away, the lowest life expectancy is in Marin City at 77, a 15-year difference 3 miles away. It starts to paint the picture of Marin and its elders. The other thing that's important to realize is that we look at what does it cost to live here in Marin for an older adult. UCLA does what's called a Marin Elder Economic Security Index. So a single elderly renter needs around $29,000 per year to live here. And that's just for basic needs. The self-sufficiency threshold, meaning can you live self-sufficiently, single individuals need more than $44,000 and couples need more than $60,000. So what you have is you have a large population here with the majority of them struggling with the number one issue we hear from elders in this lovely community, which is economic security. The average Social Security check in Marin is $1,976 a month, which is $23,000 a year. So again, you start to see what Marin looks like from a spectrum of what issues in this lovely community we have. 19,000 older adults live alone. Most of them are widowed women over the age of 75. And unfortunately, because of the number of children and ability for our kids to live near us, which is really what an American caregiver system is built on, is family caregivers. As you all know, most of the children of these older adults cannot afford to live in Marin County. So we have two issues with that in our community. Being economic security, we call the hidden poor is really the elders that really struggle here. And secondarily, they're elder orphans because most of them do not have the typical family caregiver that many of you may have had when you were raised. I was raised back east. You lived near your grandma and your grandfather or your aunt and uncle, and you took care of them. But here, because of the cost of living, we really have, most of our elders do not have that type of family caregiver support. Homeownership. 75% of Marin older adults own their homes. 25% are renters. However, when you look back at what it costs to live here in Marin, we consider, you've probably heard the phrase in the paper around here, we're house rich and cash poor. And the other struggle is that if you try to downsize in Marin, where are the housing that you can downsize and still continue to live? I live out in San Rafael and Peacock Gap for 35 years. We only use a third of our house, but we can't find somewhere else that would be able to downsize and allow a young family to move in. So we have really kind of stuck with this generational challenge that we have in Marin. So I just wanted to sort of give you those numbers as we're starting our conversation. It's a beautiful place. We all living here. But when you look at the older adult population, economic security and all the surveys we're doing, and you couple that with longevity, end up being some of the big issues that the elders face.
Thank you, Joe. Sort of adding to that, what you're saying is you often speak about the social determinants of health. Could you talk a little bit about that and what that says about growing older?
And it's interesting, to give you a little history of Marin having to do with aging services. Does anybody in the audience know the name Vera Schultz? Anybody raise a hand? There's a couple back there. Well, the reason I bring up Vera Schultz is she was the first female elected to the Marin County Board of Supervisors in the mid-1950s. And prior to that, she was the mayor of Mill Valley, a real pioneering woman who really started to look at these social issues facing Marin back in the early 50s. And there's a great biography on her. And one of the chapters is, what do we do with the old folks? And Vera was actually intrigued that this was a beautiful community of which people were coming to retire to, but it was very isolated, and what were the issues they were going to face. Vera actually went to the first White House conference on aging in America and brought all those ideas back in the 50s and started the Marin Senior Coordinating Council, which became Whistle Stop back in the mid-1950s with a group of volunteers. And what were they focused on? They were focused on what did older adults struggle with? It was transportation, it was food, it was access to medical care, it was access to safe, affordable housing. And that's what started the aging services movement in Marin 70 years ago. And it's very interesting, the reason I bring this story up, because the same issues we see today in this community are still the same that Vera identified back in the 50s. But the magnitude of need and expansion and growth has been considerable. So what social determinants are is really the non-medical issues that elders face. We all have genetics. We have predisposed some genetics. That's why we have the Buck Institute on Aging Research doing that genetic research on aging. That's one aspect. Your access to health care, nutrition, your ability, your socioeconomic ability to age is what are called the social determinants of health. And what people are finding out is these are just as important as medical care as we age. And the number one issue that has come out in all this research is that how elders have to face the challenge of loneliness and isolation. And the antidote to loneliness and isolation is human connection. And it's interesting because many people that are elders understand what I'm talking about. Our world shrinks as we get older and our loved ones pass away, and our sort of social circle gets smaller. It was very interesting because the world, and in fact the United States during the COVID pandemic, everybody experienced loneliness and isolation in some form or fashion. And it really is what many elders face regardless of a pandemic. So what we have really realized is the power of human connection. If you really look at that, it's a lost importance. And the fact is that the Surgeon General in America and many of the countries are recognizing the health impact of social isolation and loneliness. And again, looking at what we can do, and it's community-based. That's the real key. And I'll talk a little bit more about it, but that's why we built the new Healthy Aging Campus in downtown San Rafael with a revolutionary new model of integrated care where you could build a community of elders and address all of their social determinants of health.
Well, Joe, that leads right into the next question. So tell us a little bit about your involvement with the community, especially the new housing in Vivillon, and what you and your team learned about aging in Marin.
Yeah, we, as I said, people know us as Whistle Stop. It's Vivillon now, but a lot of people remind me they love the old Whistle Stop name, so I'll refer to that. 70 years of doing this work, and we were kind of faced with this issue. We had the SMART train coming into downtown San Rafael, and we realized that we'd have to move our center there. That center had been there for 60 plus years. It was kind of the social place that people went. They would go on evenings and have dinners and dances there. It was the community. So we were faced with that challenge. And so what we decided to do was not only just replicate the center services we had there, could we address some of the two bigger issues that we saw many of the community needed, which is safe, affordable housing, and also access to medical care. So what we did is do a strategic partnership with other nonprofit organizations. Eden Housing is a nonprofit housing developer out of Berkeley, and we asked them, could you build the housing component and make it affordable and safe in a downtown setting for our elders? And then we approached the Marin community clinics and said, you care for women and children, but you're seeing, even in your population, the need for elders to have access to care. So we started partnering with them, and these projects take a long time in Marin. This was a 15-year project to get it done. But we was opened in January of 2024, and for those that haven't been there, I invite you to come down. We have over 85 residents that live above, and they are all 100% affordable housing. They live in a downtown area where they're safe in case there's a fire or a crisis. They can be taken care of very quickly and safely. They can walk to downtown area. And then on the middle floor, we have our Healthy Aging Center, which has over 50 programs and services to address these social determinants of health and give them a place to get a good meal, to socialize. The way people used to live in community is there. And then on the first floor, we have a full general practice, family practice, and geriatric care medical center. So if an elder has not been able to get to see a doctor, and I'm sure many of you have friends, they may have to wait months to see a doctor, and they're 80 years old. And what we wanted to do was really give them an opportunity, sort of a one-stop location where everything you could take advantage of. And it's been successful. And I guess if you build one, everybody else wants to know where the next one can be. So we're talking to many of the other communities are reaching out to us now. My dream would be we have 2 or 3 of these in Marin County, one in south, one in the central, and one in the north, because it's what's sorely needed, and it addresses, as I said, these long-standing issues that people have living in our lovely community.
So Joe, there are a lot of resources available to older adults in Marin, but not everyone can take advantage of those resources. What are your thoughts about that? And what can we do about it?
Well, and Terry, you and I know this because we've been working in this field a long time. It's a good news, bad news in this current situation, which is there isn't a lot of government funding for aging services. Now, every nonprofit and every area in America now is struggling with government funding. We particularly we've had to find other sources of funding to really provide the aging services that we do and many of the other organizations do. I think the important thing is that we have got to be the voice of the community. Christy Denton Cohen's in the audience as chair of our Marin County Commission on Aging, and who have representatives from each of our community. We have to really fight to have a voice at the table. You would think not, because we're such a large segment of the population. But most people say, well, the older adults, they take care of themselves, their families take care of them. We don't hit the same mark of need that children do. And what all we're trying to do is convey the message to our elected officials, to funders, that we're looking for aging equity just like we look for educational equity for our children. And it's an important fight. It is an uphill battle because I think, again, people think of Marin as affluent. They think all the older adults are doing very well. But if you really, as I described in the numbers, if you really understand what's happening in Marin, it's a real challenge, and it's growing. And it's not just here. It's across the country, and it's across the world. This is the first time in the world that there have been more people over the age of 60 than under the age of 15 in recorded time of civilization. So this is a worldwide, sort of challenge that we have. There was just the American Society on Aging conference took place last week, and there was a speech given by Ken Dykewald. Does anybody know that name? He's over from Berkeley. He's been one of the world's foremost individuals studying aging. He calls it the age wave. And he gave a speech on what we all can do, and I can share that if that's okay with you guys now. His title of his speech was The Longevity Revolution, Triumph or Tragedy, and he had 5 key takeaways that we as a society and a community in Marin should consider. The first, and Terry talked a little bit this, is reimagine life stages which are being transformed by increasing longevity. It's okay that we're living longer, but the traditional life stages that everything has been built on, whether it's Social Security, you call it Medicare, et cetera, was sort of, that's shifting. So the journey through life is no longer linear, and we are redefining what it means to age with possibility. The second thing is match our health span to our lifespans, ensuring that extra years are lived in good health, not just extra years are lived. We must focus and build systems that help people thrive and not just survive through later life. Averting a new era of mass elder poverty. Many of us are unprepared for the financial realities of aging. Resilience in later years comes from a combination of strategies: improving health, downsizing housing, working longer, embracing shared living models, and fostering community support. And then this is a topic for many of us: eliminating ageism. Its impact on older adults is especially harmful, shaping policy, limiting opportunity, and distorting public perception. All of us must become the voice of this movement, demand representation, and shift the narrative. Aging is not something to fear, it is something to celebrate. Activate a new purpose for maturity. Never before in the history has humanity had the access to the depth of knowledge, wisdom, and lived experience that older adults have today. Yet too often this powerful resource goes untapped, overlooked by systems that fail to value it. We need elders' insight, resilience, drive, and bold voices now more than ever. So what you're hearing there is that things have changed, and we, older adults, have to really be the wisdom workers that make people understand the valuable part of this segment of the population, which is the one growing the most.
Joe, thank you for sharing that. That's sort of hot off the press. Thank you. Okay, we're going to shift a bit to Sonia. And Sonia is going to tell us a bit about Mental Health, this remarkable organization, and the Mental Method. And what are some of the broad approaches to providing support for families, individuals, and caregivers that your organization does so well?
Hi, everyone. Hi. I want to call out that I was called an expert. I'm not going to pretend to be one on this. I'm going to talk more about what I have come across working with people who are sick, people who are aging, people who are dying for the last 10 years. So this is more what I have seen that I want to share with you that I think relates to aging as through change. So I don't want to pretend to be an expert on aging up here. Okay. So mental health is a service that I started with my co-founder, BJ Miller, and our purpose is to provide the tenets of palliative care, and I'm gonna pause for a moment. Who knows what palliative care is? Anybody? Okay, great, super awesome. For the rest of you, palliative care is a type of whole person care that is meant to treat every type of suffering that's emotional, physical, logistical, for both the person living with an illness and their care circle anywhere along the trajectory of illness. So it doesn't have a timeline on it. You do not have to be dying. So it's this really beautiful type of care that most people don't know about or is misunderstood. So what we wanted to do was take that care and make it accessible to everybody without a referral, because how it exists in our healthcare system is most of the time you need a referral, you might have to have a certain type of illness, it has to be accessible within your hospital system, so you have to live somewhere where you can get it. And we wanted to do away with all of that and say that everyone deserves this type of care. So that's what we provide on an hourly basis to patients and caregivers, and that has kind of led us to what you mentioned, the METAL method, which is treating is the word here, caring for people in a way that exposes the human aspects of what it is to be living with an illness, to be caring for someone, not the medical aspects. So there's so much that goes into communicating with your family, your sense of yourself, who you are as a person, how you talk to your healthcare providers that are true for all of us. And what we've really come across is that change is really hard. And there's lots of changes that come along with aging, just all of us. It's a constant progression of change. So illness is one of those moments, but getting older is also one of those moments. It just happens at a different pace versus there's something that's really rocked your world with a diagnosis. So what we've come to realize is that uncovering all the human parts of who you are and getting to talk about those things leads us to a better understanding of the type of the rest of the life that you want for the rest of the life that you have between now and whenever you do find yourself at the end of that life.
Thank you. You have an interesting background working with individuals at end of life. How has that informed the services you provide?
So I'm going to tell y'all a little a personal story here. I was in my 20s when my mom was diagnosed with lung cancer. I'm an only child. This was a huge deal and fully changed the trajectory of my life. So we got hospice care very late. It was a few days before she died, but that experience of that hospice care was so wonderful and gave us just such a beautiful, I'll say a good death with her, that I decided this was what I wanted to do with people. So that experience very much leads to what I now want for others who are ill, navigating change at the end of a life, caring for someone who is that there is so much more information than what is just given to you by healthcare providers. And what we want to do is educate, set expectations, give you all the choices, and sometimes that choice is saying, I don't want that. And that is rarely given as a choice to people to say, I don't want to do that, or what happens, what does this look like if I don't do that? So what we set ourselves up to do is provide we call them clients, the people who work with us, to give them every single option. And it's up to them to say, this is what I want, this is what aligns with my goals. Okay, great. What do we need to do to get you there? If you don't want hospice care, that means you need to do X, Y, and Z to live in your home safely. If you do want this, this is what to expect. So that expectation and that education came from my own experience of my mother receiving end-of-life care for lung cancer and not being given all the information and just going off of what the doctor said, not feeling like we could advocate, not feeling like we could push back, not having her voice in the conversation. So that's where this all, for me, really came from, is wanting to provide a space where people do have the information and can really think about what is most important to them as they age, if they are at the end of their life.
I've heard you talk about pathologizing aging. So can you explain what that means to you and how we can reduce it?
Yeah. I think we pathologize a lot of stuff. So we pathologize aging for sure. We pathologize grief. Hilariously, illness, I know we pathologize, but getting sick is a part of natural aging. It's actually just a part of natural living. People who are not old get diagnosed with cancer. To them, that all of a sudden feels unnatural. So now their full illness, just the fact that they're young and sick, is something is wrong with them. And aging, I think, is absolutely the same. This idea that there is something wrong with you when you can no longer do the things that you were able to do. And this is a horrible place to come from. To your point, aging is wonderful and beautiful and should be celebrated, not, this is a problem and we need to fix this and figure it out. I don't know if I have the answer on how to reduce it. I think it's in each of us to push against that idea when we get signals of infantilization or we get signals that we are not important anymore, to know in our own selves how much value we do bring. So it's kind of in each of us. I don't know if I have an exact answer on what you can do tomorrow to reduce the pathologizing of aging, but knowing that it's not true, that it is something that has been created and made up mostly to sell things, is a big part of this. So you knowing your value and worth pushes up against that idea. And I think when you bring that idea into the world with you, it starts to push against it for others.
Well, that sort of leads to the issue of change. And so tell us more about how individuals can use a different lens to think about change and aging.
So I think that the lens on change that we have right now is very much a response to the change. So something has happened, I am responding to it. I want to get back to the way it was before this change happened. I want to return to my baseline. Versus, this is a change that has happened. I'm going to incorporate it into who I am. I might change who I am along with this change, and then I move forward in the world as a new, different person. The experience of my mother's death absolutely changed who I am. I am not going back to who that person was. I am happy with this person I am. The person I was before I had a breast cancer diagnosis, different person. I am a different person now. But trying to return to the time prior, it's a fool's errand. Like, you are now different, and that's a really cool, beautiful thing, and you get to decide what that change is going to change in you and how you get to now change for the others around you. So I think the lens versus, this thing happened, I have to respond, it's a problem, it's a crisis, and I have to get back to the way it was before, versus change is constantly happening, aging is constantly happening. It is the one constant. It will keep going and going, and the more we can incorporate it into our lives and recognize it as change, and also potentially grieve it as a change. A lot of these changes are hard. Like, you may not be able to do something, or you won't have a person, or you can't do an activity that you used to do that brings you joy. So what are we now going to do to get through those little bits, so then when we get to a really scary one, like death and dying, or a really big illness, we're a little bit more prepared. So I would look through it not as a thing to overcome, but a natural part of living a life, and giving yourself the space to grieve what you have lost. A lot of these losses have grief intertwined in them, and the more that we can recognize that and sit with it and then move forward, I think the easier it is to roll with whatever comes next.
Nice, thank you. Well, I've got the opportunity. We still have some time for me to ask questions of both of you, and you could both of you jump in, or one of you just answer it. So, how can people become involved in the community to support themselves and others as they age?
I think what I have found personally, and I know, Terry, you do a lot of it, and many of this, I see this, we're speaking to the choir, I should say. The word that comes to mind is volunteering. I retired 4 years ago. And my wife, Vicki, and many of you may know, was also worked in the homeless field for St. Vincent de Paul. And the first year, we said we were just going to not do anything and just travel, and we did that. But then we got really bored, and we started really questioning our existence because we had been really working very feverishly on the passions that we had. And I can tell you, 4 years later, we're actively volunteering and involved in causes that we really feel near and dear to the community. And so, and there's nothing better than giving back. I mean, the feeling it gives you, but the energy, and it keeps you intellectually involved. It keeps you, as I say, a lot of people in communities kind of, you read the stuff in the paper, you see it on Nextdoor, sit on the sidelines and make comments. But I believe you got to be on the field and really to make change. And so I think, particularly, we're blessed. We've got an older adult community that has time to volunteer. As an example, we've got our team here from Vivalon. You can talk to them, but we say we have a workforce of 400. We have 180 employees, but we have 250 full-time volunteers that allow us to serve the thousands of older adults, whether it's to deliver a meal, or if it's to teach them about digital literacy, or for them to learn about fall prevention. These are all volunteers, and that's where I think the strength of Marin is. When what can we do? It's not just, it's time, talent, and treasure, but I think the time is the most important thing that is going to really help us all really address some of these community issues. So to me, it's volunteering, volunteering, volunteering. Would you agree?
I absolutely agree. And you could add to that, volunteering for commissions, to be on commissions, or committees that your town or city may have, that there's lots of opportunities. You just have to look for them. And they can be very rewarding, and you can learn new things, and it can be a surprise that you could enter into a new area of interest at a later time in life. So.
I was just going to add to that is when I think of community, I think of even smaller than that, like the baby steps of who are your neighbors, who are the people that walk their dogs by your house, having short little relationships with them and moments, because the more you build that muscle now, the more that community becomes a true community. So amen to volunteering, and you can even just do it. Think of your community as even a little bit smaller. It doesn't have to be so big for the introverts in the group, like just a little bit, a little bit tidier.
I think about like the fires in LA, and I think about who are the people that were really most affected and died during those fires. And actually the fires that we've had in Northern California, it's the older adults and people with disabilities. And what you're saying makes great sense. It could be as simple as just getting to know your neighbors, the people who live next door. You don't have to be best friends, but you need to know each other. And if something happens, you can depend upon each other. Especially in disasters, really it's who you know and your neighbors. It's not the fire, it's not the police, it's your neighbors.
And I'm going to tell you a little secret. People like helping. We really do.
They do.
There's this whole thing that we don't want to bother people, and that they don't want to be bothered. It's actually not true. There's a relationship that happens when you ask for something and they get to help you, they feel good, and you get the thing that you need. Like, it's the greatest. I fully promote it all the time. Like, it is opening the door, picking up something for them, just these little teeny moments, and that'll start to build that mini community muscle. Yeah.
I'm just curious, how many in the audience volunteer now, doing something? See, this is great. So, and you can volunteer and do two things. You can volunteer. Okay, so what are a few suggestions about how our audience can advocate for healthy aging for all income levels, especially around housing, respite, and in-home care? Is a big one.
Well, I think let's just take housing, for
Okay.
example. It is, I can tell you from having developed a project, it takes a long time. And many of the elected officials really want to do the best they can, but it's amazing how a vocal minority can stop a project. And we've all experienced that here in Marin and in many of our communities. So again, this goes back to really, if you believe that housing and I think it's the number one issue in America. If housing is the issue, how do we work as a community in each of our communities to not say it can't be done, but how can it be done, and who's going to benefit from it? You know, I really get a kick out of people that say they hate traffic here, but they don't want to have housing built here. And you can't have it both ways, because 60% of our workforce commutes in. And in the case of older adults, most of our aging caregivers, those that take care of our loved ones and caring, are coming from hours away. And so I think that it's looking at, I think what Sonia said is really good, is looking at what's best for the community. You know, how can I help make that community be a better place to live for myself and my neighbors? And I think people have to have voices, as we've said. I mean, the Commission on Aging is a good example. I mean, we try to be the voice of older adults in this community, and it just has to be that. I think that the best way to get things done is for everyone to work together to address that issue, and it takes those types of efforts.
Okay. No, I think
How about
another,
you?
I know, I was going to say, I think another thing that people can do is, you live in a town and you live in a city. Just get involved in your town and city's issues. Volunteer, but also get to have a say. Make sure that the people in your community who are older adults in your city or your town have a place at the table. And you have the voice to do that. So don't be shy when it comes to working with your own town and city to do that.
And on that note, I think we're speaking about like really big issues that are, something that like the nation is advocating for and navigating. And then I think of things that you may want to do just on a personal level, like volunteer at a certain place or ask the library if they need help or whatever that might be, and start to then interact with a different type of community as well. I'm going to guess that a lot of you have skills and passions that might be applicable to new people and groups who don't know about them. So beyond just the things that already exist of like, I'm going to show up for housing or I'm going to show up for these things that are already understood, is you can make your own path and kind of disrupt whatever might be happening and say, I'd like to do this. Does anyone want to join me?
Yeah, agreed. I just want to share a story with that happened to me actually yesterday morning. I was sitting and having coffee with a friend, and I noticed a friend from my town going into the coffee shop. And she's going to be 90 years old this year. And she sat down with my friend and I, and she was talking about, somehow it came up in the conversation, rowing. And this is my own naivete. She said, yeah, she's been doing more rowing lately. And I said, oh, you're at the gym and you're doing rowing? And she says, no, I am joining a rowing club over in Green Bay. And I'm going out on kayak, and I am learning how to kayak on the bay. And I thought, it's never too late to do something new. And it is very low cost for her to do this, so she's not a very wealthy woman. And I was one flabbergasted, one that I had made an assumption that was totally incorrect. And number two, that you could be almost 90 and you could do something completely different, just blew me away. I don't know. Anyway, so. All right. I want to make sure that people in the audience have their slip of paper, and if they have questions, because there's really two great people up here who can answer those questions. So do you have them? Have you written your question down?
Yeah.
We've got questions here. Okay, this is good.
Before we go to that, I have a
Okay.
question for you.
Okay.
Now, I've known you, and I admired you, and it's okay to share that at the age 78, a couple of years ago, you decided to run for an elected office in the town of Ross. And as you approached that, what were some of the challenges, and first of all, why did you do it, and what were the challenges or obstacles you had, and you were successful, and now you're an elected official in the town of Ross?
Right. Why did I do it? Because I was asked by someone in the town there was going to be an election, and there were going to be 3 seats that were up in our town council, and this person asked me if I would be interested in running. And I've been on the Commission on Aging for a couple years and representing our town, the town of Ross. And I also was involved in an age-friendly group in the town of Ross. So I knew a little bit about the town. And I thought, well, so I said, let me just ask my husband, because I just want to make sure that if it's going to take time, I've got the time, I want to do it, but let's just see. And so he said, yeah, go for it. This will be great, do it. So it was a scary proposition, though, I must say. I've never run for an office in my life. And the things that you don't know that you need to do when you're running for office. You have to go before sort of political groups, and you've got 3 minutes to answer 5 questions about why you are running for office and what you would do in X situation or Y situation. So I had never done that. So it was meeting new people and really putting yourself on the line. I think that was it. That was the scary part. But you do it a few times, and then it's not as scary. And I figured if I was able to do it in this public setting, then I would have a voice on my town council. And I really loved my town, and I loved living there for 30 some odd years. So it was really a great opportunity for me to do something completely different that I actually now have been doing for a year and absolutely love it. So it was a challenge. It's something about challenging yourself, like the woman rowing, just to take a chance and do something different. So thank you, Joe. All right, we've got some questions. Okay. Oh, these are good. How can family members who provide 24/7 care for family members get a break? I have a feeling that there are some people in this room who might have asked this question. This is not just one person. A new program now in planning may provide respite for some. I think there's one maybe in Mill Valley that there's consideration. So here we go. Sonia and Joe, how can family members provide 24-hour care and get a break?
Yeah. Whoever wrote this, I'm assuming that you're currently going through it. So please know I understand what you're saying and what a big lift that is. 24 hours is no joke. And I will also say this, our system is not set up to support you. And that's real. And a lot of the conversations that we have with people in mental health are just about how hard it is. And just being able to have someone witness and talk about the difficulties of what it is to care for someone. To the point of thinking about community, start to ask people. If you have no one in your life, no children, no family, no friends, ask a neighbor. Start to be vulnerable and put yourself out there. I know it is extremely hard. Our culture does not value interdependence. We are very you do it alone, or the second you need help, something is wrong. Another thing, we pathologize. So it will probably be on you to raise your hand and say, I need help, and it's so hard. It's really hard, and I encourage you to do it. And it can be a small thing of, can you just go pick up my groceries, or can you take my dog for a walk? While I go do this, or can you just come here and sit with my person, and I'm gonna go for a walk because I really need a walk. And that may be the only way you get a break. And there are, programs like Airbnb has some respite homes that they rent for lower prices for family members who need time away. But truly our system is not, it's not set up to support caregivers in this way. So I just wanna name that I don't have a solution, but really the asking for something, and again, it can be small, and then you can start to work up to something bigger, but it's okay to ask for help. People want to give it to you, and they're worried that if they offer it, it will not be taken. So it might be up to you, the person who needs the help so much, to ask for it, which is big, and I encourage you to do it. Yeah,
it's a tough question. We've had in Marin in the past a couple of what we call adult day care programs, where centers where individuals from family could drop their loved one off and get a respite for half a day, an hour. I don't know if you remember, Senior Access was a program that was here in Marin for years. It was taken over by Jewish Family and Children's Services. I know Michelle Javid's here. And it was to where you, and these were for people that had certainly dementia and Alzheimer's. That is really, and it's such a big need. Unfortunately, there was to run these programs, there were state regulations and the funding didn't match, and these organizations basically just really ran out of funding to be able to continue them. We're trying to really look at how we can partner with other communities. We've talked to people up in Sonoma County. There's a program in San Francisco run by the Institute on Aging that's in Presidio, that's a day care program, they may have heard for some. It's a real challenge because, again, it needs to be funded. I mean, some people can afford private pay, but it costs upwards of $150 a day, to staff and license these. So we continue to look at it because it's going to continue to be an issue, and we're trying to elevate this issue. I wish I said we had centers right now or programs that we could offer, but we just don't have that many in Marin, and we're trying to partner.
Yeah, I was going to say there are some organizations in Marin. If you have the money, you can pay for somebody to come in and be in your home while you go out. But we're talking, if you do this 5 days a week or even 3 days a week, you're talking about thousands and thousands and thousands of dollars. You're talking about usually a minimum. They won't come into the house unless you've got maybe 4 hours that you can pay them. And you're looking at maybe $35 to $50 an hour, day after day. It's expensive. And people who are low income, it's not even an option. So
I'm going to add a few other thoughts to this. Depending on the person that is being cared for, I am a huge advocate for hospice care, and hospice care in this area is I feel very good recommending it. And if you are someone who is hesitant about hospice care, I encourage you to look into it and just get an informational visit. You don't have to sign up for it, but hospice care is the best way to get additional support into your home and get you a break if the person is at the end of their life and going to die if the disease keeps going on the trajectory it is. And part of hospice's mandate is to provide volunteer hours, that they have to do that. So that might be someone coming in so that you can get a break. That could be them doing chores and helping out. But that is really one way to get additional care both for you and your person into your home. And an informational visit costs you nothing. You have no requirement to sign up. So I'm a huge advocate for that.
if you are very low income, and I believe this, if you're eligible for Medicaid.
If you're, Medi-Cal.
Medi-Cal,
and,
that's
yeah,
it.
It's
Then there's an in-home support services program that exists through the county. And I hate to be sort of a naysayer about this, a fabulous program. But there's not enough caregivers in this county to provide the services for the people who really need it, who are low income, even if they're on Medicaid. Yeah, Medi-Cal. So there's a shortage of staff providing in-home care. So, okay, that's a very upbeat question. Thank you so
Sorry.
much.
you do good,
Thank you so
too well
much.
on that one.
Yeah, I know. So, Joe, this one is for you. Okay, are there income gaps or caps? It looks like income caps at Vivillon Services. My friend has an annual income of about $36,000, barely gets by. Do you have social workers to give advice to clients?
Yes, I mean, at Vivillon, all our services are not, you don't have to be income qualified, with the exception of the housing at the Healthy Aging Campus. Those apartments are all 100% Section 8 vouchers. So you have to be income qualified. You have to go through the Marin Housing Authority. As I said, we've got 85 residents there. There are 66 units. And that is income qualified. But all other services that we offer at Vivillon are not income qualified. They're need-based. So as an example, if you're homebound and you're not able to get a meal The fact is that you're homebound. You don't have to be at low income. We serve everybody in the county. We serve about 500 people, I think, for meals, home-delivered meals. To come to our center to be able to do some of the programs, we try to provide them at no cost or little cost, because we feel that, again, these are things that we're solving problems with. So it's with the exception of housing, it's not income eligible. And I think that's where most nonprofits are trying to go. We don't want to turn anybody away if they need something. It's just, and we usually can find, we've got staff, people here like Michelle and Marie Claire. These people work every day with these folks. And by the way, this work is individual by individual, because everybody is going through, as Sonia said, each one is going through a different journey in where they are in dealing with aging. And so this isn't something you can put and say everyone is it's a uniform way of looking at it. We look at it individual by individual, and we have if we can't provide the service, we refer people out. If they need legal aid, if they need some financial assistance, we're kind of that coordinating council, if you will, and our staff and our team will meet with anybody, and we will help find that solution for that individual.
Okay, Joe, another question for you. What role does Vivalon have in emergency transportation for older adults sort of without their own independent transport?
Well, as far as emergency, if we actually work with the county's Office of Emergency Services, if there is, and if there is need for evacuation or planned evacuation, we are part of that service, if you will. Why us? Because we know where everybody lives. We've been serving this community for 70 years. As when a disaster or emergency hits, it's going to be in the hills, if you will, and that's where a lot of our elders live in many of these communities. So we work very closely with the county in coordination, and I want to say I think Chief Jason Weber and what he's done with just preparing this community for disaster, not only fire, but really it's very well prepared. And we are part of that system. And why us? Because we can move elders, we can move people in wheelchair that they're disabled. They're usually the ones that don't get moved when there's an emergency service. So we are part of that system. We have a fleet of over 120 vehicles, and they're available when in need. We can help out.
Okay. Senior living environments like the Redwood are really great, but what percentage of older adults can actually afford this kind of living? And maybe you can throw, so there's assisted living, and then there's memory care units, can you tell us a little bit, how much do they really cost?
Well, I think this is where, again, getting back to why economic security is the number one issue in Marin, if we look at our elder population on this question, is that there's three spectrums. Let's just take the top 10% of elders in Marin can probably pick and choose the Tamalpais, Viville Marin, Smith Ranch, and probably have the wherewithal, financial means to go retire there. And many of those services, or many of those residents, take you right through even to the end of life. That's 10%. We have 10% that are called dual eligibles, meaning that they have qualified for Medicare and Medi-Cal, meaning that they are below the federal poverty level where that they are eligible for government-supported services. The problem is 80% of Marin's older adults do not have the money to have those sort of alternative choices. It's kind of sad when somebody says you have to spend down to poverty, or you've only got 10% of the population that can. And these units, I mean, my mother was in assisted living before she died with dementia. I mean, there's $12,000, $13,000 a month.
Yep.
That's about what they are.
Yep.
And that's why I think, unfortunately, people wait as long as they can to try to heroically deal with these issues at home. But it's also economic again, because we just don't have any of these viable solutions. And that's kind of where we're trying to find these new models of care, like the one we've done at Vivillon. Can we do affordable and safe housing? Can we have on-site services? Can they live almost in a college community campus in a very economically feasible way? And that's why we're trying to all come up with different alternatives, but it's really that 80% that we talk about, what we call the hidden poor. And these folks these aren't people that, these are people that were retired teachers. They work for the county. They've taken care of our children. They've taken care of they've worked in the health profession here. It just costs a lot of money to live here. And when you're needing of assistance, there just isn't that many choices if you don't have the money.
I'll add a little something to this. Care is very expensive, and I don't know how many people in this group, but the majority, I think, of Americans think that Medicare is going to pay for a lot of things, and it really does not. And thinking about what you have right now and what your reality is, what your financial reality is, what type of home you live in, what your care needs are, and thinking forward. I'm just going to plug advanced care planning right now, and I have handouts at the table if you want one, is putting yourself into this future state and thinking about what you're going to be able to afford, and really understanding what the costs are will help you understand what your reality might look like and how then we get to it, because care is so expensive. And when we're saying those $1,000, that's just the housing piece of it. You need to eat, you may have medical care, there's lots of other stuff that happens. So when we say that big scary number, like that's just one component. Care is so expensive. So taking the time now to think about what that part of your life is going to look like and what you will need is an exercise I would highly recommend for everyone. And it's hard. It's hard to do. And no one likes doing paperwork. I don't like doing paperwork. But this is a part of what it is thinking about what you want and putting it in documentation. And a big piece of that is understanding what your finances are and what will and will not be paid for. I'm assuming in Marin there's probably a few financial aging specialists who might really be able to have a conversation of this is what this is going to cost. Yeah.
We do, and we do hold workshops and seminars, and you're right, preparation, as you mentioned, is really key. And I think we're just continuing to find different models that we know the issue. It's just we've got to kind of build the solutions.
Well, actually, there were a number of questions that were related to the sort of the long-term care, housing and memory care, and how do you afford it. Here's an interesting question about now. How can you start saving for that economic security when you're living paycheck to paycheck? Okay, do we have any answers up here?
Is there a financial planner in the audience? Yeah.
Are there programs to start saving for your parents' care when they get to the age and need more assisted living? Are there programs to start saving?
I don't know of programs. I know looking into long-term care insurance is definitely one thing to do. And there's so many caveats and there's so many little things that have to happen. But in general, that type of insurance will cover a lot of the care, and what happens is people buy into it and then don't end up using it. But familiarizing yourself with the different types of insurance is one of the ways to start thinking about this. But as far as financial planning, I mean, this is a question I think for everybody. How do I save for a future to pay for this care? I don't know if I have an answer.
No.
Yeah.
No. Yeah, me neither. How can other counties start to build a program like Marin County's Healthy Aging Program?
We're actually we're in discussions up in Sonoma County as an example, and I think it's very interesting. We call this the North Bay, and what I'm finding over the years is the borders are starting to blend between Sonoma and Marin, certainly north, because they have a lot of the similar issues. They have a little more population up there. So we certainly, what we have to do is kind of put the best practices together that we've done in each of these communities, and how do we build more of a regional model. And there's a program on the border between Marin and Sonoma. It's called Age Well, which is what's called a PACE program. And PACE program was one started by Medicare, which was a really good program. It was started in San Francisco, and it stands for patient proactive care for the elderly or something like that. But it was started where basically if you qualified for it, they would take care of all of your care. They run centers, all the things I'm talking about. It's called the PACE program, and they have one on the border of between Marin and Sonoma because you need a certain number of patient population to be able to run one of these successfully. So that's an example. We sort of built our integrated care model off of that because, again, PACE is for, it's called dual eligibles. If you spend down all your assets, quite honestly, as an elder adult, you become what's called a dual eligible, Medicare and Medi-Cal, and then you can qualify for these programs. But just to me, there's something morally wrong with having elders have to spend down into poverty, or have the family, spend it down into poverty to be able to provide care. And that's where I think we're all trying to find these alternative models.
This is sort of a last question. I think all of us, as we get older, our family members as well as ourselves, may have questions about, okay, I want some additional support. I want to know what services are out there. I want to know where I could go to get X, Y, and Z. Where do you go in Marin County if you want to know what services and resources are available? Who has that information? How complicated is it? Can it be straightforward?
Well, we happen to be working right now on, there are probably several dozen nonprofit, small to medium to large nonprofit organizations throughout Marin that all provide some sort of service to the elder population and to families. And we all try to have our own information. And what we've been working with the county, and they've funded this, is to do a new community-wide, county-wide resource guide for aging services. So this would be a comprehensive guide, both available online and print, that is a compendium of all the services. And it's not only a directory of services, it's a resource guide sort of educating, what is palliative care, et cetera. So we've got the county to fund that. It'll probably be done towards the end of this year. And we're trying to make that be the living document that living communication tool that we can all use in every community that we serve. So I think there's a lot of information out there. But I also want to caution everyone, what we have found over the years working, you have to sit down with an individual or that family member and really understand that individual situation. There are certainly broad-stroked services we all talk about, transportation, meal delivery, but we have found, I think, in experience is you have to sit with that individual and family member and understand and try to really customize what is going to help them deal with their aging challenges.
Right. I know that there is a countywide information phone number that you can call, and it's actually managed 5 days a week, and it's managed by social workers. And they're hired by the county, and they know the resources. You can meet with them over the phone. You can meet with them in person. And I believe they are here in the other room, and so when you leave, you can actually go talk to them and find out, how you can reach them when and if you ever need them. So I want to just take a moment to thank our panel members. This has been great, and your questions, which were really excellent, so thank you. But let's give a hand to them. We're all going to be around in that other room where there's refreshments and great information about community resources, so look forward to talking to you. Thank you.
Thank you, everyone.
Well, Terry, Sonia, and Joe, thank you for all that you provided us with today. Your stories, your insights, your recommendations are so appreciated. And while I doubt I can say that we're ready to start celebrating aging, I think I can say that after today we feel better about it, better prepared to face the challenges that might relate to ourselves or to loved ones. Thank you also to the audience for attending today. Please join us in the other room for the reception. Let's continue to the discussion. And on your way out, please fill this out and drop it off. Thank you so much. Have a great evening.